Dementia is a very serious illness that haunts over 5.5 million Americans today. With age, your chance of getting dementia increases. Less than 1% of people under the age of 60 have it, but by age 80, your chances increase to 30%. 6 to 20% of nursing home residents have dementia, and not only is it very serious, but it's also very expensive. The annual cost for treatment of dementia is about $30 billion. What exactly is dementia? Dementia is progressive intellectual and behavioral deterioration associated with diseases of the nervous system in older people. Common diseases include Alzheimer's, vascular dementia, and frontotemporal dementia. Dementia can be reversible, in which it can be treated and a person's intellect and behavior becomes normal or near normal again. But in most cases, dementia is irreversible, in which case this is called progressive. It is not treatable and the patient continues to get worse. It's neurodegenerative, in which the brain and nervous system undergo a change for the worse, which leads to death. Some causes of reversible dementia include vitamin B12 deficiency, drug abuse, anemia, kidney and liver diseases, or brain infections. Causes of progressive dementia include the brain cells breaking down and dying, in which this case it is neurodegenerative, cerebrovascular causes, in which damage to the blood vessels in the brain, infection-related causes, in which an infection causes it, and other causes include viruses, bacteria, parasites, toxins, and metabolic causes. Lastly, trauma can be a very serious cause of dementia through an injury or concussion to the head and brain. When looking for dementia, here are some symptoms to watch out for. Cognitive symptoms include memory loss, difficulty communicating or finding words, trouble with reasoning and problem solving, difficulty with task, planning, organization, and confusion. Psychological symptoms include personality changes, depression, anxiety, paranoia, agitation, and hallucinations. Language deficits is another thing to look out for, in which they are less concise, repeat questions, they have grammatical errors, difficulty maintaining conversations, following demands, and reading comprehension. Perception changes also take place, in which they have difficulty completing familiar activities, recognizing familiar faces and objects, and it can also impact your feeding and swallowing as well. They may forget to eat meals, take in less food and drink than normal, or forget how to chew and swallow. Now for the assessment of dementia, it is done in phases. A speech-language pathologist screens for cognitive impairment and uses standardized instruments to assess orientation to time, place, and person. They then do a comprehensive evaluation of communication function. Before this test, hearing tests, vision tests, and medication examinations are done. While performing this comprehensive assessment, they ask about case history, education, and occupation. They review auditory, visual, motor, cognitive, and emotional status, and hear from the family about their goals and preferences. They also assess swallowing, in which they evaluate the oral mechanism, the patient's ability to comprehend and recognize food, and utensils. They do food and liquid trials and assess the influence of cognitive factors on feeding and swallowing. Lastly is intervention and treatment. Treatment is based on the stage of illness, age, social history, and linguistic background. Treatment options are made in collaboration with the clients, families, and health professionals. Intervention for progressive dementia includes processing info, self-regulatory skills, auditory services, and communication demands. One type of therapy is cognitive stimulation therapy. This focuses on actively stimulating and engaging the individuals in a small group setting. There's also memory training programs which are used to help improve memory skills, reality orientation programs which help reduce confusion and improve quality of life, reminiscence therapy, in which they use life history and experience to improve their sense of well-being, and lastly, validation therapy, which involves validating or accepting the values and reality of the person with dementia. Thank you.